and all the relief is given to the people.
A delegation of the Meghalaya Asha Workers Union sought government's intervention in framing rules to prevent removal of Asha workers without any reasonable or valid reason. The delegation met Health Minister Dr. Ampreen Lingdo to apprise her on various grievances concerning their day-to-day functioning. Speaking to reporters, Soni Kharjana, the advisor of the union, said they had apprised the Health Minister to enhance their honorarium of Rs 2,000 per month and to implement free medical benefits either from MHIS or any other schemes. She also said that there have been cases that they have been removed from work just because of personal reasons with village headmen. Although no assurances were given by the minister, she said the minister has fixed another meeting on July 10th to discuss further on these grievances faced by them.
Today we just sent her a memorandum. We brought a codling with us. With the memorandum that we have the 3 points with us. The point number 1 is to increase the honorarium from the state that the Asha used to get only 2,000 rupees per month. And point number 2 is to implement or incorporate a full coverage, free treatment for the Asha, either from the MHIS or from any other suitable for the purpose. And number 3, to frame rules for preventing a regulation the Asha workers from unreasonable removal of the Asha from their jobs without any valid reason, therefore by any authority. And we already had a discussion with her, but till now we haven't get any assurance from her since she already called again. She already fixed another meeting on the 10th of July.